This is the second part of the investigations regarding appendicular abscess, and the investigations were some lab tests and imaging techniques. So we come to the lab test first. Hemoglobin was quite normal, but total leukocyte count was 25,000 per cubic millimeter, and the patient was running fever, and this was very marked leukocytosis. Platelets were normal, ESR was 107, urea, creatinine, electrolytes within normal limits. Plain X-ray abdomen done over here, not very significant except some shadowing in the region of the psoas muscle, but not very significant. Chest X-ray was done to rule out any pulmonary pathology or cardiac pathology, all within normal limits. And X-ray lumbar spine, which was offered by, requested by neurologist, the lumbar spine were within normal limits. The bodies of the lumbar vertebrae were within normal limits. The intervertebral discs, pedicles, all were within normal limits. Now we come to the CT abdomen, and this is the longitudinal view. Shows collection of lesion ma. This is an abscess in the right iliac fossa over here, over here. This is the hepatic flexure, outlined because of the contrast. There's the descending colon. This is probably part of the small gut. These are the small gut lobes. And when we look at the transverse section, the abscess starts in the lower abdomen. From here you can see collection of the abscess over here. Getting bigger and bigger, very large over here. And the CT report was there is evidence of hypodense mass in the right iliac fossa. The mass is involving in the right iliopsoas muscle in the pelvis, with also superior extension to involve the right psoas muscle up to the level of L3. So this is a very big collection going up to the psoas muscle, right up to the level of L3. The mass is involving the posterior and right abdominal lateral abdominal wall, just above the level of the iliac crest. Appendix is not visualized, separate from the mass. The mass is focally abutting the caecum and terminal ileum segment with contiguous thickening of its wall. The mass shows multiple loculi and septation within it. The mass measures about 11.5 into 10 centimeters in AP and transverse diameter. Craniocaudal extent of the mass measures 11.5 centimeters. Findings are most probably due to perforated appendix with surrounding abscess formation in the right iliac fossa, involving the iliopsoas muscle and contiguous bowel loops. There is presence of a simple cyst in the mid-cortex of the left kidney, measuring 2 by 2 centimeters. This was an incidental finding. No lesion seen in liver, gallbladder, spleen, pancreas, adrenals, right kidney, urinary bladder, seminal vesicles, and prostate. No evidence of abdominal, pelvic lymphadenopathy. So our provisional diagnosis was appendicular abscess, and we included in the differential diagnosis psoas abscess, which can follow tuberculosis of the spine, tuberculosis of the ileocaecal region, and carcinoma of the caecum. Now in the next video we'll show you the surgical intervention which we did. So I end over here. Thank you. Good Hafiz.